You can now add Toronto's SickKids and Holland Bloorview Kids Rehabilitation Hospital to the list of employers enacting vaccine mandates. It comes as the Delta variant continues to threaten the global recovery from COVID-19, and many governments and employers are pushing to get as many people vaccinated as possible to reduce the impact of the fourth wave. Joining me now to talk about all of this is Dr. Ronald Cohn, President and CEO of SickKids. Dr. Cohn, thank you very much for being with us tonight.
Thank you so much for having me.
So let's begin with your new vaccine policy. It goes further than the directive set out by the province. So explain to us how this plan will work and why you felt it was needed.
So as a children's hospital taking care of acutely ill children, we are in a unique situation because at any given time, about 70% of our patients are below the age of 12 and thus not eligible for vaccinations. Many of those patients are immunocompromised and at even higher risk of getting severe complications from COVID-19. And if you put that into the context of the significantly higher transmissibility of the Delta variant that's currently circulating within the province, we just had to add another layer, a very powerful layer, to our bundled measures of infection prevention and control in order to maximize our ability to protect our patients, our families, but also our staff and really all of our individuals who are working at SickKids.
So how exactly will the policy work then?
So we are now starting an increased campaign around educating our staff members who have not been vaccinated yet. We have continued our education throughout really the last 6 months and since we started our rollout, but we are now going to individualize yet again and try to educate everyone in order to get as close to 100% as possible. We will, in the interim, provide testing as an opportunity for people who have not yet been vaccinated. But everybody who is working at SickKids, within the walls of SickKids, has to be vaccinated by October 15th.
Okay, got it. And what if they're not vaccinated? What will happen in that case?
We will keep all options open, and we will have to consider issues like unpaid leave of absence, and I just hope we don't get to that point. With our increased education plus the context that I just presented to you earlier of having these vulnerable children that cannot be vaccinated, I hope that we will get to our target of as close to 100% as possible.
You already mentioned the Delta variant is the leading concern, but what is the latest in terms of what we know about how Delta is affecting children specifically?
So it's a very good question, and we are in constant contact with colleagues either in the United States, in the UK, and in Israel, where the fourth wave is already much bigger than here. And I can tell you, as of now, we do not see a signal that the Delta variant per se makes children sicker. And I think there's a very important distinction. The issue of the Delta variant and the increased hospitalization of children is really related to the higher transmissibility of children below the age of 12 not being able to get vaccinated and an increased community transmission that just has lots and lots of children get infected. Now, I don't want to minimize that point. It's very important that we keep our community transmission as low as possible, plus really create kind of a ring fence by immunizing as many adults as possible who are around children to protect our children. But it is important that as of today, at least, there is no signal or indication that children get actually sicker than before.
Okay, well, that is good to know. But to that last point, teachers in this province will not have to be vaccinated. They can either get vaccinated or undergo regular testing. And the teachers' unions and many doctors have spoken out about this, saying that it doesn't go far enough and it leaves kids vulnerable, just like you were implying there. What do you think should be done in terms of teachers and vaccinations?
So I do think it is important to consider a similar mandate of vaccinations for teachers and all school staff. I absolutely think it's important. If a testing regimen is put into place, it needs to be a very rigorous testing regimen to really make sure that nobody gets into the school who is positive. And I do, however, want to emphasize, given the higher community transmission that we are seeing right now, a lot of infection prevention and control measures will be put into place, similar like last year. Many updates to ventilations in schools have been made. So taking all of this together, we still feel confident that children should get back to school in person come September.
Okay, Dr. Cohn, thank you very much for spending some time with us tonight. We really appreciate your insight and perspective.
Thank you very much for having me.
And Dr. Ronald Cohn is the president and CEO of SickKids.